Welcome back to the Morning Blend. Well, most of us know our health should be a priority, but most moms schedule more appointments for our kids than for ourselves. Many women then make time for a yearly exam, but many also put off tests and procedures that could help with unnecessary symptoms and problems.
Today we're going to tell you about an in-office procedure and others with new technologies that will make health care for you more accessible, comfortable, and convenient. Dr. Brian Baer is an OBGYN with Aurora Advanced Healthcare in Wauwatosa. Thanks for being here, doctor.
Good morning.
Nice to have you.
This is exciting. You are actually Molly's doctor.
I knew she was going to point that out.
Is it odd looking at her from this angle?
No. We spend a lot of time talking.
But you actually have been her doctor for a long time, delivered all 3 of her children.
Yes, and she's very introspective and asks wonderful questions in the office.
Oh, that's nice.
Yes.
Thank you. Oh, that's really cool.
It's such an important relationship, I think, between a woman and her doctor. And that's something that you really stress, is making sure that women feel comfortable with the doctor they've chosen, because there are so many health issues.
Well, I think as a gynecologist, we are the gatekeeper for a lot of women, and we are the ones that they see primarily. And so if you give them the time that they deserve in the office, it opens doors for them to discuss all those things across the board with their health care, from skin-related problems to bleeding abnormalities and everything.
And do you feel like a lot of people ignore or kind of live with symptoms or pain or problems when they really don't have to, because they put themselves so low on the list?
Well, I think certainly moms put themselves low on the list. There's no time for anything these days, as you know. But I think there's a stigma with talking about these things, and if you give people the chance to talk about their problems in the office, for example, incontinence, urinary incontinence, a lot of times they'll delve into it and they'll want to be worked up for it. And that's one of the procedures we do in our office setting now, is we evaluate people for urinary incontinence, and it gives us the information to help treat them for it.
Women's health care in general is evolving, and there's a lot of new trends that are coming out, things that women can expect to make it more convenient or accessible for problems that they may have. What kinds of trends are you seeing?
Well, we're seeing a lot more in-office procedures. We're set up to do things that keep people out of the hospital. Obamacare would like that. They would like us to keep expenses down, but at the same time, it's all better for women. It's less invasive procedures. They get a much better bang for their buck.
And so you're talking about things, and I know you brought some examples, things like permanent birth control, ways to stop heavy periods. Those things now can be treated in your office.
Absolutely. And what's interesting is, with regards to permanent birth control, it's the age-old story. It's a woman coming into the office for her postpartum visit, and you say, well, what are you planning on doing for birth control? We used to do tubal ligations on people primarily, but then vasectomy, as a rule, was a lot easier and less invasive. And the patient will look at me and say, my husband is having a vasectomy. I go, okay, well, how about if I talk to you about a less invasive procedure that has no incisions and no recovery that we do right here in the office, and it takes 10 minutes. They look at me and they go, I don't think we'll talk to him about that. He'll have the vasectomy.
Yeah. Well, which one of these, just point to it if you would, treats that?
This is the Escher device, and what it is it's a small little coil, and if you can focus in on the end of this device right here,
yep.
The little coil at the end actually goes up into the tube, and it's literally this big. It's tiny, and it scars the tube shut over a 3-month period of time. It's felt to be the most effective form of birth control you can have, if you want permanent sterilization.
Yeah, and it's permanent. So what else did you bring?
Well, I brought other forms of birth control, which of course most people know about the Mirena IUD. That's medical management of birth control, and also you have the copper IUD that goes in for 10 years. The Mirena is a 5-year device, and that goes up into the uterine cavity. And then we brought instruments to talk about the things that we do to help women who are having abnormal bleeding, or people who have retained IUDs or lesions in their uterus. We have our diagnostic hysteroscope here, which actually goes right up into the uterus. We do this in the office. This requires very little anesthesia, if any at all, because it's so thin, and we can do things and look within the uterine cavity and do biopsies and treatments without having to take people to the hospital and put them to sleep.
And the thing is, the recovery is so much quicker, right?
The recovery is instant. With these type of procedures, there's no incisions and there's no recovery, and people leave the office. The last procedure that we have to talk about today is the uterine ablation, and that's a procedure that there's a day recovery. Again,
Okay.
there's no incisions, but we load people up on Valium and narcotics, and we give them anesthesia, and then we do the procedure. Now, a lot of people have abnormal bleeding. A lot of people have painful periods. They have fibroids. They have, and actually now people are coming in and they're just saying, I don't have anything. I just don't want to bleed anymore. And so we can do this in the office, and it's a great tool. We put this scope up into the uterus, and we run hot water for 10 minutes, and it basically cooks the uterine lining and kills it.
That's amazing.
Wow.
I think what's exciting about this is that people don't have to live with the problems that they're experiencing. Make sure you ask your doctor about this and to visit an Aurora physician who can help you take control of your health. Visit aurora.org/findmydoctor, or you can call this toll-free number 1-888-863-5502. Great to have you on the show.
Thanks, Dr. Bear.
Thank you.
Thank you so much, and we'll be right back.